there are multiple SID causes for sudden infant death, sudden SID syndrome, and there are some that are environmental, just how the child is sleeping, and that can be cured just by sleeping positions, and that's important. What we are studying here is really a genetic cause for SIDS. Genetic cause in this particular case is that enzyme that breaks down fats is defective. So the fats, the wonderful fats that are in the mother's milk, unfortunately in this case are the cause for the child not being able to digest them, and unfortunately that causing a defect in their heart. This is not yet a cure for SIDS, this particular kind of SIDS, but it's very exciting because we found a new aspect of this disease that could allow us to make molecules that might help these patients. I was a long time ago, lived in Finland, and I had a family friend who unfortunately had a sudden infant death happen to their baby, and it was devastating for that couple. And since I've been very interested about the causes for sudden infant death, it is very exciting to think that this kind of our work might contribute for future better treatments and cures, and help the heartbreak for the parents who find their child having these mutations. We can do genetic testing in the parents, find out whether there are these mutations, these carrier mutations in the parents, and even if the child is found to have a disease like this in the newborn testing, now we hope that in the future we can treat the children for the real cause.